In the symposium today, we'll be talking about anti-scarring treatments for glaucoma surgery. We'll be covering mixed trabeculectomy and also tubes. And also, my co-chair, Dr. Shanlin, will be talking about treatments that target the ciliary body.
You know, the thing is that we had adult surgeons bringing their perspective to pediatric cataract surgery, pediatric ophthalmologists bring their perspective so that the children get the best, of both worlds.
Fresh content, renowned faculty, one new name. Welcome to WOC 2020 Virtual. Hi everyone, and welcome to the WOC 2020 Virtual Highlight Show. And welcome to day 4 already. So what do you think so far? Well, I must tell you that the level of engagement has been fantastic. Almost as good, you might say, as the great content we've been watching these past days. And joining me to discuss it, we have Professor Martine Jager, Professor of Ophthalmology of the Leiden University Medical Center in the Netherlands. She is the organizer of the oncology program of this conference. Good morning, Professor Jager, and thanks for being on the show.
Good morning, Donatello. Good to see you.
Good to see you too. Some good stuff presented in this Congress. Maybe we can start off with retinoblastoma. We heard today that many children are still dying from retinoblastoma in Asia and Africa. At the same time, we heard that in other parts of the world there is a 96% treatment success rate. How is that such a difference exists?
It is the fabulous side of the World Ophthalmology Congress that we get information from so many different countries. And there were several symposia in the previous days about retinoblastoma, one from Africa, one with a global perspective. And what was very striking was the different ages when children get to see a doctor. In China, where they had checked almost all of China, children came when they were about 2 years old. In Africa, they come when they are 3 years old. But in Los Angeles, they are seen under the age of 1. And it is very striking that in the developing countries, when the children come so late, there's still a large percentage of the children that come with very large tumors and develop metastases. There were data coming out of countries like Mali and Ghana, where they now have centers to treat retinoblastoma. But as one of the ladies who spoke said, about 50% of children have very large tumors and can develop metastases. She asked a question of Dr. Berry in Los Angeles about metastases, who answered, well, we don't have those children. So the big thing is to get children to an eye doctor as quick as possible. And that was also the message of Dr. Desjardins, who works for the French-speaking African countries. Bring a child that has one white eye to an eye doctor.
Very important information indeed. Thank you. The COVID-19 pandemic has seemingly accelerated the use and the range of telemedicine for treatment and teaching. Could telehealth be a potential solution in part to help overcome discrepancies in retinoblastoma treatments?
Another talk that I watched was about telemedicine for retinoblastoma, where doctors who do not have so much experience in that disease can show in a multidisciplinary group their patients to experienced doctors in a completely other continent, another part of the world, and then say what would be the best advice to do this. And then, of course, this conference itself to change in a few months' time from a real conference to a virtual conference where anybody in the world can watch the educational programs here on their phone, on their iPads, on their computers, wherever they are. That is an amazing example of telemedicine. And the progress in this type of education would have gone extremely much slower if COVID had not happened. It's I think the only advantage of having this epidemic. Otherwise, it's horrible. But it has advanced care probably for many people. And on Sunday afternoon, there was a session about artificial intelligence on pathology. That also is a
Yes.
very quickly developing field, which may make more progress now as well.
Yes. Well, cherish that advantage at least then. Let's turn towards immunology, as this is a hot area at the moment and was covered during the first day of the Congress. Most uveal melanoma remain resistant against new therapies with immune checkpoint inhibitors. I heard that we can grow immune cells from the tumors. Can this be done at scale?
You listened very well to the presentations. It came up in a discussion that we had with Bill Harbour and myself about potential antigens that can be targeting uveal melanoma. For cutaneous melanoma, these new immune checkpoint inhibitors have worked for about 1/3 of people. It's really saving enormous numbers of lives. For eye melanoma, it is not yet the case for the uvea. But as has been shown from recent work from the group of Copland, of the group of Harbour, one can identify different sets of T cells. And both in Harbour's lab and in my own, Dr. Gaskin, we have been able to grow T cells from uveal melanoma and target tumor cells. So this is only experimental work, but there is a promise that one day it may be possible. Not yet at the clinical scale, but there are more promises than we ever had before for immunotherapy.
Okay, well, let's hope for that. Since immune checkpoint inhibitors are new and ocular oncology is an evolving field, is there evidence-based data for orbital and ocular surface tumors?
The great problem with this type of tumors, as is well known also for publications, is that the tumors are so rare. So
Yes.
we have to depend on case histories and small series. But luckily, those series, especially for the cutaneous lesions, show similarities with cutaneous melanoma. And for instance, for conjunctival melanoma, one should really look deeply into the comparison of targeted chemotherapy and targeted immunotherapy, because in that field, even with small series, it looks very, very promising. There were some excellent sessions about this, also taped sessions, not live ones, for this for this conference.
All right, thank you. The cornea is also one of your fields of expertise, and there was a great session on challenging corneal cases. It seems that treating the loss of corneal transparency so that it doesn't lead to blindness remains a real challenge. What advanced regenerative and restorative therapies are there on the horizon that will help with this?
For this question, I recommend people to look at the very beautiful session of Dr. Kinoshita from Japan, who organized that.
Okay.
It had a summary of just about every technique, whether it's for ocular surface or for endothelial cells, scraping off the endothelial cells or tearing off descemet membrane and replacing it or not replacing it for Fuchs endothelial dystrophy. That was a very good talk. Putting cells of the corneal endothelium inside the anterior chamber. Or I was surprised that already 10,000 K-pros from Dr. Dolman in Boston have been implanted worldwide. So current techniques are getting better and new techniques are evolving at a very fast pace. Cornea has become an electrified area.
That's great. Thank you, Professor Jager. Today is the last day of the live sessions. Are there some sessions coming up which you're really looking forward to?
Yes, I'm going to watch a lot of talks, as I've done the last couple of days. There is a session about big data, how to handle large sets of data, for instance, on genetics, either in Europe on rare diseases or big data sets worldwide from Asia. And that is in the session of the Academia Ophthalmologica Internationalis. I will address the Cancer Genome Atlas project together with Dr. Bita Esmaili. And that is an introduction about the collaborations in oncology between about 30-40 people, how to define subsets of uveal melanoma. There are tumors that are very malignant and those that are not so malignant. And one has to know why some tumors metastasize and others not. And that subject will come up in the really big session about uveal melanoma that is being held today. And that addresses items like HIF1 alpha, the subject of the Nobel Award last year, messenger RNA, but also clinical subjects, how to differentiate nevus from a uveal melanoma, and also the use of MRI imaging for melanoma. So I'm very much looking forward to that session, which has a lot of very interesting talks, all targeting the future for this disease.
That sounds amazing. Thanks for highlighting that. And of course, there's more coming up. We've got more great national and regional society sessions, including those from Rensko, talking about treating the myopia epidemic, Canada, cutting-edge oculoplastics, and Italy, about adopting new technologies and advanced cataract surgery, to name but a few. Also, we've got more glaucoma, cornea, and medical retina, plus that uveal melanoma session that Professor Jager was just talking about. Tune in for the last day of live sessions. It's going to be great. See you soon, and bye for now.